CEO and founder of the Deuk Spine Institute, and today we'll be broadcasting live our second surgery of the day, which is a Deuk laser disc repair. This patient has two bad discs that are degenerated, herniated, bulging, annular tear, and she's having pain in her back going down into her right leg. She's failed conservative treatment, and we're going to be going in and basically doing the Deuk laser disc repair to get rid of her back and leg pain at L3-4, L4-5. So let's get started. She's awake for the beginning, and we've given her some numbing medicine. Hopefully it's enough. If not, I'll have to give her a little more. Let me know if you're uncomfortable, okay? Shot. So we're going to navigate to L3-4 and L4-5. We're a little bit higher than I want to be. Shot. It's a little better. May have to still come down a little bit lower, but I'm going to go for 4-5 first. Are you comfy? All right. Shot.
There's a little soft spoken. I might translate for you.
That's fine. Shot. All right. You can see she has some arthritis of the facet joints. I could feel that. Shot. And my goal is to pretty much get into that disc space right there. Shot. Some big facets. Have to start a little bit more lateral. Shot. 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 People with collapsed discs still have pain from those discs, and you can actually see her herniation there. I'm trying to just get her right around the facet. Shot. Big arthritic facet joint. Shot. Are you comfy? Okay. Shot. Let's get an AP. It's a little higher than I want to be, but let's just see where we are. Just lay still. Everything's fine. Yeah, that's pretty good actually. Better than I thought it would be. You can see the giant bone spur back there. That thing is not causing any problems for her, the giant bone spur there. That's way in the front of the disc, and it's not causing any issues. We're in the back of the disc right now. Back to a lateral. All right, so I need to be a little bit lower. And yeah, I can feel this huge shot. Huge facet. I'm going to try to come a little bit lower. Shot. That's too low. Shot. Yeah, that's better. If I can get around that facet, I can feel the needle on the facet getting deflected. Are you comfy? I want to talk to her. Shot. Shot. All right, we're right there. Let's get an AP. So you want to use two views, AP and lateral. You're doing great. Just lay still, okay? No leg pain?
Are you having any leg pain, Ellen?
That's perfect. I was getting pushed a little lateral by the facet. So let's see if I can actually get into the shot, this space. Come on, Jordan. We're right on the back of the disc. It's so collapsed. Shot. Are you okay? Shot. Shot. Feels like we're in. Let's get a knife. We're going to make our incision. So once I've gotten access to, I always go for the hardest one first, because the reason I go for the hardest disc first, which is the 4-5 in this case, is because when you go for a difficult disc to get into, you're going to have to adjust your position top to bottom, side to side. And I want to make sure, because if I go for the easier disc first and I put the incision here higher up, then I may not be able to get in from this incision. I have to do a second incision. Okay, so always go for the hardest disc first. That's my advice if you want to do these surgeries. Now we made a 1/4 inch incision. Blood pressure is a little bit higher than I want it. Dr. Berndes is slow playing it. He's just trying to buy time until he puts her asleep under propofol. Am I right? You're slow playing it? All right. What are you giving her, Labetalol? Good, yeah. Shot? All right, we're going to go for 3-4. So, again, we've got the arthritis shot. There's the big facets. Oh, no, other way. You went the wrong way. Let's go. I need to see 3-4. Uh-huh. I don't know. What do you think, Jordan? I think you're off on orbit a little bit. There's definitely scoliosis between 3 vertebral body and number 4. And you can actually see there's a rotational anomaly other way. So when we adjust the fluoro position, it gets better. That's really good. We want a true lateral. And a true lateral actually requires being lateral to the spine where we're operating. Now, some people have scoliosis, so it's not going to be shot. It's not going to be possible to get a true lateral if you don't move your fluoro properly and try to capture the true lateral. So you got to adjust the WAG. You got to adjust shot. A little bit lower than I want to be. Shot. Perfect. You awake? Shot. I want to make sure she's awake. She's helping me right now get into the disc. Are you awake?
Helen, you okay? She said yes.
All right, we're almost done. I'm going to put you to sleep soon, okay? Shot. There's the herniation. Literally, you just went through it. Shot. AP. All right, we're at the back of the disc now. This is number 3-4. Jordan, let's show the audience the number. Can you use the white arrow and show them the number 3 bone? Actually, show them the sacrum first. Henry, are you on the x-ray?
Yep.
All right, so there's the sacrum. Show them 5-1, the disc 5-1, which we're not fixing. Yep, and then number 5 bone, number 4-5 disc. Yep, number 3, yeah. That's the number 4 bone, then number 3. So then the 3-4 disc, I'm about to enter. Perfect, thank you, Jordan. All right, so let's get the AP view. That looks perfect. You can see the scoliosis, folks. She's got probably a good 20 degrees plus of scoliosis, but we're not fixing her scoliosis. We're actually going to be fixing her pain and the pain down her leg without fixing the scoliosis. That's our goal. It's not that we don't want to fix scoliosis, it's that it's unnecessary to fix. Shot? Are you comfy? Shot. So she's clamping down, making it a little difficult to get in. Are you in pain?
Helen, are you having pain? No?
Okay. Just maybe her scoliosis is really bad with closing down the foramen on this side, trying to get into the disc. So we're so close. I mean, the end plates look nice and lined up, so I think we're good on the fluoro picture. I'm just up against a little bone spur that's giving me a little hard time to get in. So, oh, there we go. There we go. It's tight, very tight. All right, are you comfy? Okay. So at this point, I'm very happy with the needle at 3-4. The 4-5, I'm not as happy. I'm not as confident in the position. I feel like we're a little lateral when we entered the disc, so I want to verify it. But we also want to see if these discs are the cause of her back pain. We do what's called a discogram to verify that. Most of her symptoms are leg. Here is the L4-5. And here is the L3-4. A discogram allows me to see the inside of the disc, what's going on using a dye, and it also allows me to test the patient's disc to see if it is a painful disc. Are you comfy?
Helen, you doing okay?
She's doing fine.
Yes.
All right. How bad is that?
How bad your pain? 0 to 10. To the 10?
How high did that go?
8 or 9?
9. Is that where you typically get pain?
Said 9.
All right. So that was L3-4. Take this, please. That was L3-4, and it was a 9 out of 10. Concordant. Now, the next disc, I'm not as sure that we're in, so we're going to use the dye to find out if we're in. So the dye can also be used not just to see the inside of the disc, the annular tear, also shows you where the herniation is, because it outlines the herniation in the back of the disc. You can actually see it on the, show them the herniation there, Jordan. Yeah, right there, perfect, yep. So there's a herniation on the right at L3-4. And now we're going to test L4-5. Again, I'm not 100% sure of our position, so this is going to be a very helpful shot. It looks like we're in the disc. She's responding. How bad is that on a scale of 1 to 10?
Huh?
How high did it go? How high did it go?
9 or 10?
10.
Is that the pain you normally have, Helen?
Bedwear.
She said yes. Recorded.
Yeah, so she had a 10 out of 10 at L4-5, and that's the pain she typically gets, so let's mark that down. So this is the L4-5 disc, and she has a tear here that's causing her pain, 10 out of 10, and it's concordant because that's where she typically gets pain. So we got a 9 out of 10 at L3-4 concordant, and we got a 10 out of 10 L4-5. Now our patient gets to go to sleep. So she's helped me navigate to the disc. She's also given me very valuable information about those discs, whether they're painful or not, whether they're causing her pain that she gets every day, and she said yes. All right. Let me know, doctor, when I can proceed. My anesthesiologist is going to put the patient to sleep. I'm going to take this needle out and leave the guide wire. Luis, great job. By the way, earlier today we did a Deuk plasma rhizotomy patient, and he's from Canada. He had facet pain, and his pain is now gone. He's very happy. That was our first surgery for the morning. Now listen, you're watching this surgery. If you have questions, feel free to type your questions up. We do the broadcast for educational purposes to teach people. So any question about spine or spine care, whether it's therapy, physical therapy, injection, surgery, or just anatomy questions are fine. Anything related to the world of spine, happy to take your questions and try to answer them for you during the live stream. Okay, you can see we're going in here with a small 1/4 inch incision. I'm using a dilator right now. She's responding just a little bit, but we've got to get through the herniation. We're going to literally go right through the herniation right now and push it back into the disc, so it's out of the foramen. And then we're going to go right through the tear in the back of the disc. So remember, the herniation came out through a tear in the back of the disc, and we want to go through that tear so we can repair it. Okay, that's our goal. Shot. You can see the disc space is opening.
Good.
Hold on. Let me just verify. Yeah, we're good. Shot. Yep. Removing the guide wire. Shot? Yeah, that is a collapsed disc space, is what I could tell you right now. Shot? That is a collapsed disc space. Very scarred down. There we go. Yep. All right, so I know it looks brutal, folks. That's why we broadcast, so you can see everything. Trust me, open back surgery with fusion is far more brutal. This is just entering into the disc space. That's why you have to hammer it. You want control over the amount of force that's being applied. This, by the way, before we get started with this, this is the tube through which we're going to do the entire surgery. Okay, this is an endoscopic tube. It's called a tubular retractor. And this is not a percutaneous procedure. If it was percutaneous, we'd be just doing it through needles. But we've taken the needle out and we're going and making an incision. And this is an endoscopic procedure. Some people mistakenly call it percutaneous, but it's not. Shot. All right, now I'm putting the tube into the disc space. Shot. We're in. Take that. And we're going to remove the dilator. And this is the toughest of the two. Twist it. Nice. Beautiful. Great. So, all right. We're going to do the entire surgery through this tube. We're just going to reposition it for the second disc when we're done with this one. Is she relaxed? Doing good?
Nerve pressure is best I can.
Well, where are you at?
135.67. Just checking it out.
129. Should be okay.
29.60. That's pretty good, right?
Yeah, I mean, lower is better, but I'm okay with that.
Stock chance are all right.
You understand why, right?
Yeah, yeah. What's the hematoma?
Yeah. So let's, or worse, epidural. Let's go ahead, Henry, and show our audience how does a herniated or bulging disc, degenerated disc, how do they cause back pain? And how do they cause leg pain? Let's run our video showing them.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
The tube. Okay, Dr. Deuk with you back, and we are inside the L4-5 disc. It's a very tight disc, very collapsed. Nope. And I think she's actually crushed the tube. You can see the shape of the tube is now oval, like a tic-tac rather than round. And that happens at times when somebody has really bad degenerative disc disease. The good news is the surgery is going to go fine. We're going to fix her problem. But if you look to the left, that surface there is the superior end plate of L4, of L5, and to the right is the inferior end plate of L4. So we're actually inside the disc. And this is endoscopic disc surgery, folks. And there is the source of her back pain, right there. The annular tear. And that's what makes this procedure unique. It's the only surgery in the world that debrides the annular tear to get rid of the back pain. Guys, there's a tube here over my pedal. Thanks. No. It's wrapping around the pedal.
Oh, I see what you're saying.
Yeah, I need that moved.
You have.
Thanks. All right, go ahead. All right, so we're bringing in the laser. This is a job for the laser, okay? There's no other tool in the world that works. The laser is the best tool. This is an FDA approved laser for medical purpose. It's actually approved for the disc. And other things in the body besides disc, like kidney stones and prostate tumors. But it's a wonderful laser. It's very safe. We've never had a single complication from the laser. Actually, there was just one little one, and it was where the laser fiber broke in my hand, and it literally burned a hole in my finger. So the complication was not for a patient, it was for the surgeon. But it was just a little blast, and it healed up. I still have a scar on my fingertip. And that right there is the tear, and that's what we're debriding, folks. This is where the back pain comes from. She had 10 out of 10 back pain here. It's coming from this spot. And again, the Deuk laser disc repair currently is the only procedure in the world published to do an annular debridement in the medical literature. It's been published, I think, 8 or 9 times at multiple different societies by different surgeons and peer reviewers. All neurosurgeons, of course. Some orthopedic spine surgeons, and we've been performing the surgery now for 16 years here at Deuk Spine with zero surgical complications to date. We have had no infections, no spinal fluid leaks, no nerve damages as a result of the surgery itself. Of course, people come here with nerve damage already, and that's one of the things we're trying to fix. These are all parts of the herniation that was here at L4-5 that we shoved back into the disc when we did the dilator maneuver. Okay, you got to be moving that fiber for me, helping me.
Yes, sir.
Just about done with this level, doctor. The reason there's not a lot to do at this level is because this is a degenerative disc disease with pain and pinched nerves. So we don't have a whole lot of herniation to remove because there's not a whole lot of herniation left in her back. You know, her disc is pretty dried out, desiccated. But this is where all the pain comes from. And once again, you won't find this surgery offered anywhere else in the United States, to my knowledge, at this time. We've been teaching surgeons about it for years, but I don't know where else it would be done. But from my standpoint, I wouldn't go to anyone else unless they've done the training with me formally. And that requires me signing off on them that they're doing this procedure properly with good technique, safety. Let's go ahead and run the video for our audience, Henry, that shows how the surgery works. Like, what does the laser really do? Why does it work? How does it fix pain? Can you do that?
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. We're just finishing up at L4-5, just about done here with the Deuk laser disc repair. I just want to say this weekend I went down to a meeting, a neurosurgery meeting called the Florida Neurosurgery Society, which I'm a member of. And they have an annual meeting where we sit and listen to lectures by surgeons on topics. One of the lecturers was Dr. Kevin Foley, who happens to be a pioneer in the field of spine surgery. He's out of Tennessee, and he gave a talk on patenting ideas and intellectual property, which was a good talk. I enjoyed it. But he is truly a pioneer in the spine field with minimally invasive type of surgeries back in the 90s and 2000s. And we talk about here on our show a lot about the cost of implants and the surgeons that make royalties and payments from licensing their intellectual property for these screws and rods and cages that go into fusions and artificial discs. You wouldn't believe the amount of money that they make. You know, he makes more money from his implants than I make in my entire career. In 1 year he does. So just to give you an idea of just how much money is in these companies like Medtronic and Deuk, Synthes, Johnson & Johnson, these cages and screws and plates and rods that go into people's backs. And it's just staggering the profits that are being made when people don't need those surgeries anymore now that the Deuk laser disc repair is available. All right, we're just putting a little antiseptic. We use betadine. We've never had an infection with the Deuk laser disc repair. And, you know, partly because there's no bleeding. There's a small incision. Everything we do is sterile. We treat it as a sterile surgery rather than as a non-sterile pain management procedure. So we treat it like a real operation because it is a real operation. And we use antibiotics. We use a sterile operating room, a Class C operating room at the surgery center, which is a real operating room, not a procedure room. We do sterile prep and drape like a real surgery because it is a real surgery. And we use betadine irrigation. So we've never had an infection. I've done over 1,500 of these surgeries with 0 infections to date. So compare that to open surgery with screws and rods. The infection rate can be as high as 10% or even higher. So this is a much safer surgery to do rather than microdiscectomy or laminectomy. Microdiscectomy doesn't treat back pain, by the way. It only is really to treat leg pain from a pinched nerve in the back. A lot of people don't know that. And most people with a herniated disc and a pinched nerve, they got back pain too. So the back pain doesn't go away with a microdiscectomy usually. If you ask your surgeon, if you're doing a microdiscectomy, are you going to get rid of my back pain? The answer will be no, because they don't do the microdiscectomy for back pain. They just do it for leg pain. And even then, it doesn't work that well. All right, how come I'm not seeing you there? Okay, I see. Yep. At this point, we've completed our Deuk laser disc repair at L4-5, and now we're going to go to the L3-4. That's our next one. All right. At this point, guide wire is in place, shot, and shot. We're going to take this needle out and leave the guide wire. Ooh. There we go. Shot. Again, it's very tight because the disc is not just herniated, it's also degenerated. Look at that. Look at the needle, how bent it is. You guys see that, Henry?
Yeah, we see it.
Here?
We see it, yeah.
That's from the bones literally crushing down on that needle. So you know why it's so hard to get the dilator in. These bones are so stuck together from the inflammation going on in the disc, called discitis. And it's not an infectious discitis, it's an inflammatory discitis from basically her own body attacking the disc injury, trying to heal it. Shot? All right, so let's see what we got here. Let's not push. Let's just take a look. Shot? Uh-huh, we're getting in there. Shot? All right, take that. Come on, pay attention. I need you to pay attention to my needs here. That's your job. Shot? Good. That felt good. All right. I can actually feel the dilator passing through the tear and then going into the disc. And there's this sudden release. Yeah, Luis, we need a new tube because I think this is still usable, but it's going to need a little straightening out. It's just bent a little bit. Maybe we got it. I think we're okay then. I just reshaped it like a blacksmith, minus the forge. You know, they talk about cold welding, right? This is cold straightening, cold reshaping. All right, good. So the tube was bent just a little bit from her bones. Hello, come on. Oscar. Shot? All right. Shot? Now, for those of you who don't know, what we're doing here is we're actually pushing the tube into her disc. The disc is soft, so we're not really going into the bone, we're going into the disc. We're going between the bones where there's a joint. And what we're really doing is we're debriding that joint because there's a lot of pain and inflammation. What? Yeah, we're good. We're good. Thank you. All right, get the fluoro out. Any questions from the audience?
Yes, we have one from Jerry Dosher from Vietnam on Facebook.
All right, Jerry, how are you?
And they asked, what are the calibration and or pre-testing requirements for the laser to ensure it is working properly? Can the pre-op testing, EKG, and blood work be done overseas prior to visiting Dr. Deuk?
Okay, great question. So we got a couple of questions from a viewer who's in Vietnam. And to answer your questions, number one, the laser is maintained and calibrated through what's called a preventive maintenance program, where it's checked for calibration and proper functioning. And then, of course, as far as the pre-op stuff, the EKG, blood work, can it be done overseas? It can. However, when you get here, we need to do it again. We don't accept out-of-country EKGs and blood work. It has to be done in the United States. That's just a requirement. And the clearance has to be done by a U.S. doctor. So if you get it done, somewhere else in the United States, it's fine. But we can't accept a foreign doctor, and we cannot accept a foreign tests like EKG and blood work. I'm sorry. Not that we're discriminating or anything. It's just from patient safety and standard of care kind of things. We have to do that. We don't have much choice in the matter. All right, so these are all pieces of the herniated disc. You can see they're stained blue, and it means they're degenerated. Great questions, though, and I appreciate you asking them. So you can see that the L3-4 disc is different than the one we just did. It's less degenerated. There's still some degenerated disc material in there that's been breaking down from the inflammation. Now, if our patient did not have the laser surgery, the next option that might work for her would be a fusion, a decompression and fusion. Let's show our audience the difference between, and this is a big herniation, by the way. Let's see if I can get it out. It's coming out in pieces, but before you run to that video, I want to see if I can get this out. It doesn't want to come out of the tube, it's so big. But I might get lucky and no, it's coming out in pieces, so let's see one more time. Yeah, well, it's just coming out in pieces. It's too big to come out of the tube. Remember, the inner diameter of the tube is around 6 millimeters, and it just won't fit. So I'll keep taking this out. You guys take a look at this video. It kind of shows the other option for these patients to get rid of their back and leg pain is a well-done fusion. But there's a big difference in terms of recovery time, blood loss, pain, scar tissue. Risk of complications is higher with fusion, of course. So let's show our audience those two options side by side. Oh man, it's like a cork in a wine bottle. It's stuck.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A patient with chronic back or neck pain originating from a symptomatic disc injury could undergo either traditional spinal fusion or less invasive Deuk laser disc repair. This MRI represents a typical case with L4-5 and L5-S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the secured vertebrae. Cross-links are added to bridge the rods together for additional stability. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. Prior to closing the wound, a temporary drain is installed to allow excess fluid to drain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's half-inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
All right, come on back and take a look. Can you see this?
Yes.
Okay.
Yeah, wow.
These are pieces of a herniated disc in fragments, and these mostly came out of the L3-4, but also out of the L4-5. And this is what degenerated disc looks like, okay? It's kind of tough. It's cartilagey. And it stains blue because what's staining blue is the degenerated nucleus pulposus, which happens in a herniated disc. Now I'm going to show you, we did the entire surgery through a small 1/4-inch incision on her back, right there. You see that?
Yep.
So no big open surgery, no scar tissue, virtually no bleeding, and the patient will leave here with almost no pain, usually, and taking just some anti-inflammatory for a day and a muscle relaxer. And that's the Deuk laser disc repair. Other surgeons would be doing fusions for this patient, big open fusions. So Avoid open fusions. It's not necessary. Send us your MRI to mri.deukspine.com for a free MRI review to see whether you know or somebody or yourself would qualify for a Deuk laser disc repair for a herniated disc, bulging disc, degenerated disc. Go ahead and type up your questions. I'll come answer them for you face to face in a few minutes. Let's show our audience our new testimonial from our patient from last week. Again. All right, so now you've had the surgery. How are you doing today?
I feel awesome. I mean, the only pain is, surgery site pain, and that's
Okay.
it. No nerve pain.
So the pain that you had before the surgery is
Gone.
gone, cured.
Gone. Yeah.
Awesome.
Yes, that's amazing.
I'm Dr. R. Deuk Majan with the Deuk Spine Institute, and I'm here with one of my patients who just had the Deuk laser disc repair on her lower back, and she wants to share her story with you. Now, you came to Deuk Spine Institute because you were having back and left leg pain for how long?
Well, the terrible left leg pain, probably about 2 years, but prior, I've had issues since I was 14 years old. So it's been a lot of roller coaster pain since then.
So you've had back pain since you were 14. You're clearly not 14 anymore.
No.
And so that's like 15, 20 years, right?
Yeah, too long.
And so why didn't you get it fixed sooner?
Well, the doctors when I was younger didn't want to operate. They wanted to, I was young. They didn't want to take a chance because all the surgeries then at that point, there was just nothing there that wasn't going to be traumatic to my back and my spine. So I went through physical therapy, shots, decompression. They did that and nothing was really working. And then it eventually kind of got better, and then it would get worse and it would get better, and it was just up and down, up and down.
Up and down. And the reason it got better was the inflammation from the injury to your disc started to get better.
Yeah.
But then you'd have another herniation with activity, and then it made it worse. So
Yeah.
when we were in there, and you can see from this video right here that we were pulling out lots of big fragments of disc herniation. You probably over your lifetime from 14 until now had at least 10, 20 different episodes of herniation, and that's what we saw when we were inside there.
Mm-hmm.
All right, so now you've had the surgery. How are you doing today?
I feel awesome. The only pain is, surgery site pain, and that's
Okay.
it. No nerve pain.
So the pain that you had before the surgery is
Gone.
gone, cured.
Gone. Yeah.
Awesome.
Yes, that's amazing.
Now, you're not from Florida.
No, I'm from Ohio.
So you traveled from Ohio to the Deuk Spine Institute in Florida. Why did you come all the way down to Florida?
There was nobody near us or anywhere near us that had any other option besides either getting a discectomy or a laminectomy or a fusion. There was just nobody was doing anything else. And I knew I didn't want to do that again because I'd already had that done. So it didn't work. And
Didn't work.
I had a really amazing physical therapist that connected me with you, and the rest is history.
Yeah, your physical therapist found us and was intrigued with the surgeries we're doing here
Yeah.
and sent you here. So what are you going to tell your physical therapist? I call him Dr. Salinas. What are you going to tell him when you...
Oh man, I've already told him. I texted him the minute I got back to our Airbnb. I said, I feel amazing, and I can't wait to tell all the rest of the patients in our Facebook group, this works. So
It does. The Deuk laser disc repair really does work. Well, is there anything else you want to say to your fans out there or friends?
my fans and my friends, thank you for praying. Thank you for believing me. I think that's one of the biggest things. There's a stigma around back pain because you can't see it, that people are just faking it, or maybe they're babies. Why can't you just deal with the pain? And it overwhelms you. And so to come someplace that believes me and then fixes the problem, and now I'm sitting here and I can be a fully active mom. So I'm just beyond thankful. Thank you.
Yeah, chronic pain robs people of their dignity and their happiness and joy in life, and also their loved ones, the people that care about them.
Yeah.
Because they suffer with you.
Yeah.
Yeah.
A lot.
Well, congratulations and praise God.
Yes.
You found us.
Thank you very much.
And I think you're going to do fantastic.
I'm looking forward to being strong again.
Awesome. All right. And I'm Dr. Deuk. We're just wrapping up a surgery on the spine. This is a lady who needed back surgery because she's had really back pain coming from the degenerated disc at L3-4, L4-5. Don't mind the screws and rods, she didn't have that. But we recognized that her pain in her back and down her right leg was really originating from what was a herniated disc here and here. And what I did was we did a transforaminal approach coming from the side, endoscopic, and I basically did a debridement of the tear. And you could see at the L3-4 there was a big herniation. We were trying to pull it out. That herniation was actually sitting outside the disc, and when I put the dilator in, I shoved it back in through the tear. That's the beauty of the surgery. It actually, the use of the dilator, the way we do it, going through the tear on the side of the herniation, literally pushes the herniation back in the disc, and then I can safely remove it from inside the disc. The place you want to be careful here is in this zone. It's called the foramen, and by pushing the herniation into the disc, I'm taking it out between the vertebral bodies. It's very safe. There's no blood vessels in there, no arteries, no veins, no nerves. So it's a safe area to start pulling things out. And that's one of the advantages of what's called the inside out technique. Some surgeons start in the foramen and start nibbling the herniation out here. More dangerous. I don't recommend it. I learned the inside out technique from Dr. Anthony Young. He's a pioneer in this technology. He's amazing. He was in Phoenix. Now he's retired, but he's probably one of the most important mentors I've ever had in my career. And he's taught me a lot about lumbar endoscopic surgery. So shout out to Dr. Young. He was at the Desert Institute for Spine. I can't remember what the C stands for. I think it was DISC, D-I-S-C, over in Phoenix. But he doesn't do the exact Deuk laser disc repair with the annular debridement. That's a technique that I developed and published in the medical literature. So we have long-term outcome data on the Deuk laser disc repair procedure. Those people who have had it done end up with very good long-term results of eliminating their back pain from those discs, eliminating their leg pain, and weakness, numbness, tingling in their leg. The study that we published looked at patients who had had the Deuk laser disc repair done on their lower back for at least 5 years. So it was at least 5 years since their surgery. By the time we got all the patients in the cohort, they had 6 years of follow-up. So an average of 6 years. And I can't remember how many patients. It was either 60 or over 100. We showed that those patients that had the Deuk laser disc repair for back and leg pain, they ended up with a 92% elimination of their back and leg pain still at 6 years follow-up. That's long-term data. 0 complications and great results. So all done with a 1/4-inch incision. All right, we'll take your questions.
Right. This first one comes from Julie Karak. Forgive me if I said that wrong.
Julie Karak, we believe,
Yep.
from YouTube?
From Facebook.
Facebook.
Yes.
Hi, Julie. Dr. Deuk here. Thanks for joining our live broadcast, live stream.
And she said, I live in the UK. I have pelvic spondylitis 2009, cervical spondylitis 2009, and lower degenerative spondylitis. Worst at the L3, L4, L5 with prominent facet joint hypertrophy in combination with shallow dysgenic bulging narrowing the lateral recesses. More so on the left in 2009. Would I benefit from this type of surgery?
Great. So the question is, if I understand it correctly, our caller has a problem with discs in her lower back as well as her neck. And we call the arthritis of these, so let me just say that a disc is a joint because it's a place, a space between two bones next to each other where there is movement. If you watch the disc, there's movement. So the disc is really a joint, And the facets, which she also talks about having enlarged facets, those are joints too, okay? So every segment of the spine has two parts. It's got two discs. It's got a disc joint, and it's got really two facet joints, a left and right facet joints. And she's got spondylosis, which is collapsing or arthritis of the disc. Now, the reason why it's not called arthritis is because arthritis is truly reserved for inflammation and degenerative changes of what's called the diarthrodial joint, like a facet joint. So she has facet joint arthritis with enlargement of the facets. She has lumbar spondylosis and cervical spondylosis with a collapsing of the disc. The question is, with those diagnoses, if they are causing her symptoms, which we don't know yet, I have to verify that, but if they are causing her symptoms of back pain and leg symptoms, would the Deuk laser disc repair work for her? The answer is 100% yes, absolutely. You just saw this lady. She had scoliosis. She had collapsed disc with spondylitis. She had facet arthropathy, and yet we've just tested her discs and they are causing her pain. I just repaired them with the laser. That pain will be gone. Her back pain will be gone and her leg pain will be gone. Now, she may have facet joint pain later on. She may get some arthritis pain in her facets. We come in and do a rhizotomy using plasma. It's called the Deuk plasma rhizotomy. It gives a more permanent fix. Long story short, yes, anybody with a degenerative disc, spondylitic disc, is going to be a candidate for what you just watched, the Deuk laser disc repair. It works great for those patients.
Awesome.
Next question.
Next question comes from Rigaleb on YouTube.
Rigalep on YouTube.
And he goes, if you need to go through the disc to reach the herniation, doesn't it mean to you make another hole to get there? And then he added on saying, actually, I think that this is for cervical, because for lumbar you go through the back, right? Not through the abdomen.
You are correct, Rigalep. So you're correct in that it's for cervical, but let me show you what happens. All right, so I'm going to grab my cervical spine. So he's asking, Dr. Deuk, correct me if I'm wrong here, but isn't the herniation at the back of the disc? The answer is yes. And when you do a cervical, don't you come from the front of the disc and go all the way through it to the back and then use the laser to repair the tear in the back and remove the herniation? The answer is yes. Well, aren't you putting a hole in the front of the disc? The answer is no. What we're doing is we're spreading the fibers, okay? We're spreading the fibers open with the tube, and then when we leave, we take the tube out, the fibers close back up. So it's kind of like passing through with a needle. If you take a needle and you push it through your clothing and then you take it out, there's no hole in your clothing. It just spread the fibers apart, the cotton fibers or whatever fibers, the thread, and then when you take the needle out, they come back together. That's what we're doing, because the annulus fibrosus in the front of the disc is fibrous. It's made of fibers. And we're literally just spreading them apart and letting them come back together. So there is no hole being made. Great question.
And this next one comes from 7.3 Who on YouTube.
7.3 what?
Who?
Who?
7.3 Who.
7.3 who? Is that, I don't know why it's so funny, but
I don't know, it's
on
funny.
YouTube, but it is what it is.
Yeah, that's awesome. He doesn't really have a question, but he's just really appreciative that that you're taking care of his friend today who has a surgery coming up. And
Oh
he's
yes,
just really grateful.
absolutely.
Yeah.
So 7.3 who on YouTube is basically doing a shout out for his buddy who's having surgery next. That'll be our next surgery. Yep. Hope it all goes well. I know that next patient's a bit anxious, but I expect that patient to do very well. All right, so thanks for being concerned for your friend. That's a good friend that you are. And we'll be broadcasting that surgery next. That will be a right L3-4. Well, it's a one side L3-4 and then the other side L4-5, L5-S1. So that patient has 3 herniated discs, and 2 are on one side, 1 is on the other side, and we're going to fix all 3. That's my goal. All right, so stay tuned and come back in about 40 minutes, 45 minutes, and we'll be ready to broadcast the next surgery. It'll be a Deuk laser disc repair for 3 herniated discs in the lower back, L3-4, L4-5, L5-S1. Hope you enjoyed the broadcast. By the way, if you haven't done it yet, go to the App Store on your phone and you can download the Deuk Spine Institute app, and you could watch our live streams through the app. You can also submit a form for free MRI review. We have a library full of spine conditions with, it's pretty good put together, explaining things. Yeah, but it's free, no charge. And we also have the free MRI review at mri.deukspine.com for somebody who's in pain with their neck or back and they want to know what needs to be done or what's causing the pain. Happy to do that for free. Hope you enjoyed the broadcast. We'll be back later.